Hi, my name is Singh, and this is my global healthcare systems assignment. And for my country, I chose India. To introduce India, its political setup consists of a federal union of 28 states and 8 union territories, and its capital is New Delhi. Its population is roughly 1.4 billion and became the world's most populous country in 2023, so kind of interesting. Its economic status in terms of the World Bank income level is listed as lower to middle income, and to sum up, its location is located in South Asia and occupies most of the Indian subcontinent. To touch on India's health system, they have a mixed system consisting of both public and private providers, and the responsibilities are shared in a federal setup where the states play a lead role, and the national government has policy/financing oversight over that role. In terms of the organization of care, the public network is organized into 3 tiers: the primary tier consisting of the primary health centers, the secondary tier consisting of community health centers, and the tertiary tier consisting of teaching or specialty hospitals. To touch on the coverage mechanisms, they consist of tax funding services by government finance purchasing/insurance schemes, social insurance for formal workers, and schemes for central government employees. And in terms of the role of the private sector, it provides a large share of both outpatient and inpatient care and engages through contracting initiatives with public facilities. To touch on the patient pathways, is intended for referral from primary to secondary and then tertiary, like I mentioned earlier, and the patients often access private providers for higher levels of care. To touch on India's funding mechanism and access to care, they have a financing mix. Their health spending comes from government budgets, household out-of-pocket payments, and social security/insurance. Additionally, they have smaller shares of health spending that comes from enterprises, NGOs, and external donors. And in terms of their level of spending, the total health expenditure, abbreviated as THE, was 3.83% of their GDP in 2021 to 2022 and 3.73% in 2020 to 2021. In terms of how users pay and access care in practice, their care is purchased or financed via public schemes and social security for various services, and when the payment's not covered, the households pay out of pocket. Additionally, their funds flow to both public and private providers. To touch on India's strengths of the health system, they had a comprehensive primary care increase, and they had a health scheme called the Ayushman Bharat that established 12 comprehensive primary health services with medicines and different diagnostics. Additionally, in terms of their financial protection for the poor, they had health insurance schemes that provided entitlement-based hospital coverage at impaneled public and private hospitals. To touch on their public health backbone and outreach, they have a long-running national program under the National Health Mission that supports vaccinations, maternal/child health, and prevention. They also have a mixed provider base and the availability across public facilities and a wide private sector. In terms of India's limitations on the health system, they have underfunding and high out-of-pocket payment. Historically, low public governmental spending has led to high out-of-pocket costs, especially for medicines and diagnostics. Additionally, in terms of their access to medicines and diagnostics in the public sector, they have weak procurement and logistics, and that means more gaps in availability at the public and government facilities. They also have prices in the private market, which remain high for many essentials that should be available in these public or government facilities. Additionally, in terms of the regulation and equity challenges, they have weak regulation of the private sector and its growth, and it contributes to variability in quality and concerns in affordability. They also have geographic dispersion where rural and urban gaps exist because better trained providers and better healthcare providers overall concentrate in urban areas, thus affecting the equity of access. This is my reference page, and when I was looking for references, I was looking for sources that are both authoritative and also reputable. For country basics, I used the WHO Data Indian profile that took into account statistics like population and income. For geographic and political setup, I use the Encyclopedia Britannica, and for health system details, I use the WHO Health Systems and Transition Review for India. Finally, for current financing number like GDP and total expenditure, I use the Ministry of Health and Press Information Bureau National Health Accounts, and thank you guys. I hope you like my presentation.